Assalamu alaikum. My name is Niharshad Khan and my roll number is BP1650166. I am a student of 5th Prof morning and the drug that I have been given is ethanol. Basically, this video is divided into 6 sections. We will first talk about of introduction of ethanol, then its rational and irrational uses, then we will see different brands that are available, the drug-drug interactions, and the antidote to ethanol, and lastly a case study of which I will be sharing notes. Starting off with the introduction of ethanol. Ethanol is a clear colorless liquid which is rapidly absorbed from the GIT and distributed throughout the body. It has bactericidal activity and used as a topical disinfectant. It belongs to different classes such as antidotes, nerve depressants, antiseptics, and disinfectants. Primarily, alcohol is indicated in conditions like kidney ablation, which is a type of therapy to kill kidney cells in cancer therapy, nerve block, which are any deliberate interruptions of signal along a nerve, often for the purpose of pain relief. Also used for the methanol poisoning, ethylene glycol poisoning, premature labor, and lastly, complex regional pain syndrome. Basically, it is a broad term describing excess and prolonged pain and inflammation that follows an injury to arm or leg. The irrational use of ethanol includes the abuse of this drug because of its deep CNS depressant activity. It is used as a sedative and hypnotic because it makes a person feel better, and it means an escape for some people who are under immense stress. Let's talk about the mechanism of action of ethanol. There are various mechanisms by which ethanol will affect the human brain. It can either alter the ion channel or the enzyme, or can have an effect on the receptors. Ethanol also binds directly to the receptor of acetylcholine, serotonin, GABA, or the different NMDA receptors for glutamate. Though these effects are mediated through the GABA receptor, it has an anti-infective role as it is a dehydrating agent and disrupts the osmotic balance across the cell membrane. Ethanol is contraindicated in conditions like seizures, renal impairment, postpartum hemorrhage, and hepatic diseases, as there are side effects of ethanol, which can be intoxication, frequent urination, nausea and vomiting, hypotension with hot flushes, agitation, and hypoglycemia. Generally, there are many drug interactions with ethanol, but some severe interaction of ethanol with different drugs include methotrexate, metronidazole, acetretin, sodium oxybate, disulfiram, etc. There are different forms in which ethanol is available. For example, in the form of an injectable solution or a medicated liquid soap, mucosal spray, and it's available in different topical forms such as gels, lotions, sprays, and solutions. And the concentration in which it is available is ethanol 10% 5% intravenous solution, ethanol 98% injectable solution, ethanol 62% topical gel, ethanol 95% topical liquid. Now I would like to share the different available brands of ethanol with their pricing. As you can see, the albucinol is the most expensive one, which is used as ablative agent. Next, we have the dehydrated alcohol injection for the methanol toxicity, and the rest two, nozzle and the applique antiseptic gel hand rinse are used as antiseptic basically. In case of an ethanol poisoning, the doctor firstly have to monitor the vital signs. They have to prevent the patient from breathing and choking problems. They can For that they can use a breathing tube. They have to give oxygen therapy, also IV fluids, vitamins, and glucose. They can also give the activated charcoal to minimize the body's absorption of alcohol. They also may need to fit a catheter and through pumping carry out gastric lavage to minimize the absorption of ingested alcohol. A particular drug that is useful in acute ethanol intoxication is metadoxin, which accelerate ethanol excretion. Now moving towards the case study, we have a 17-year-old male present to the emergency department after accidentally ingesting a large amount of methanol because he thought it was Gatorade. He is not a suicidal and denies any co-ingestion, and also the paramedics did not found any substance or pills in the house. The ingestion occurred approximately 4 hours prior to the emergency call. He is currently complaining blurred vision and nausea. Subjective. The age of the patient is 17-year-old. He's a male patient, and chief complaint is of blurred vision and nausea due to the intake of large amount of methanol. There is no previous suicidal attempts and no history of depression. Objective. These are the vital signs. As we can see, the patient having tachycardia and having regular rate and rhythm without murmur, but the capillary refill is slightly prolonged. He is awake and alert, and also the examination reveals the dilated pupil with sluggish light reactions and poor accommodation. As the patient has taken large amount of methanol, so he is diagnosed with the methanol toxicity. Plan or the treatment for this case is that initially we will focus on stabilizing the airway circulation. Then we will start ADH inhibition therapy with the ethanol. So the ethanol with the sufficient concentration greater than 100 milligram per deciliter is used, whose loading dose will be 15 ml per kg of 5% ethanol, followed by a maintenance infusion of 2 to 4 ml per kg per hour. Ideally, ethanol blood level should be maintained between 100 to 150 milligram per deciliter, and when the methanol levels will reach below 20 milligram per deciliter, treatment can be discontinued. Side by side, we will carefully check the acid base status, as the bicarbonate therapy may be required. Also, the cofactor therapy with the folic acid is sometimes used to eliminate formic acid. And lastly, after the ADH blocking therapy, the elimination of methanol is required via pulmonary or renal route. So, hemodialysis is performed in the end. So, these are the references. Thank you for your time. Allah Hafiz.